Hello, my name is Ricardo Paul Leighton. I am going to talk about a cellular carcinoma. Definition. A cellular carcinoma is a primary liver cancer derived from the well-differentiated hepatocyte. It is the more frequent in adulthood than in the childhood. Alternatively, Chinese is the core lifestyle individual as the resulting in the exposure of a large population to risk factors that contribute to liver cancer. Risk factors include hepatitis caused by either hepatitis B or hepatitis C virus, type 2 diabetes, metabolic disorder, excess body weight, alcohol consumption, and tobacco use. It has also been observed that the risk of liver cancer increases substantially with that increasing body mass index.
HC is called the silent killer. The impact is really not the patient himself. All the families are affected.
因为在中国呢，有100万人是乙肝病毒携带者。
Hepatitis B carrier status and hepatitis C carrier status are really the predominant risk factors of HCC, which cause inflammation and cirrhosis. With the advent of hepatitis B vaccination programs in childhood, we expect that to drop, and it has already in many Asian countries. Today, the world has changed phenomenally. The new risk factor that's a concern to everybody is fatty liver, and a lot of that can be attributed to a modern urban diet.
Now we have very high prevalence of the obesity and diabetes. We have to put more attention about this. I saw a patient, he was diagnosed at a late stage of liver cancer. He even cannot walk. So he has to rely on his wife to take care of all the daily activities. Family members and patients, they want to have more treatment options. So it is very important to help the patient access to more effective treatment to improve their survival rate and get a better quality of life.
Application of medicine. Signs and symptoms are usually non-specific. Diagnosis is based on alpha-fetoprotein levels, imaging tests, and sometimes liver biopsy. In patients at high risk, screening tests with periodic FEP, Mesomek, and ultrasound are usually recommended. The prognosis is poor when the cancer is advanced or liver sentence function is abnormal, but in a small tumor confined to the liver, ablative therapy are palliative and surgical resection or liver transplantation is sometimes cure.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the third most common cancer in the world and one of the leading causes of cancer deaths. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease, and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patients. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. And we have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is directed towards the most appropriate care, rather than being filtered into what the center is an expert at. We're an expert at all three modalities of treatment rather than just the one.
Pros and cons. Pros. The currently the biggest changes in the systemic therapy of advancing parallel cellular carcinoma, find new immunological antidrugs such as lenvatinib and the combination of the atezolizumab with bevacizumab in first line, regorafenib, cabozantinib, and ramucirumab in the second line have been shown to improve survival in the patient with parallel cellular carcinoma has been approved by the European Medicine Agency EMA.
The incidence of liver cancer is rising. It's expected to be one of the fastest growing malignancies in the United States and the Western world in the coming years. I've been working in the liver cancer space here at UCLA since the end of my fellowship in 2003. At that time, we had no systemic drugs to improve survival for patients with advanced liver cancer. Recently, we saw the approval of a new regimen for the treatment of advanced liver cancer. This is the combination of atezolizumab and bevacizumab, two intravenous monoclonal antibodies. This regimen reduces the risk of death from advanced liver cancer by 42%. 27% of patients who get the regimen have a significant response, and those who respond for a long period of time. For the first time in more than a decade, a new systemic treatment regimen was superior to sorafenib for improving survival in advanced liver cancer.
Cons. A few clinical studies have evaluated the use of immunocheckpoint inhibitors as initial treatment for liver cancer, but concluded that they do not work well alone. Upon further investigation, the center leader discovered that it is possible that high concentration of a protein called vascular endothelial growth factor, VEGF, may prevent the action of immunocheckpoint inhibitors. Uses apply in Ecuador. In 2009, the INEC reported in the Ecuador an incidence of H.3 cases. 100,000 inhabitants figured that we made it good from being a low country risk to a moderate risk country, tripling the incidence registered in 1,999 of 2.7. 100,000 which is caused for cancer today. Conclusion. The Hepatocellular carcinoma constitutes 88% of all primary malignant neoplasms of the liver, being the neoplans why the higher mortality were while possessing a greater predilection in the male gender. Hepatocellular carcinoma is disease multifactorial that can occur in any situation that causes a sustained liver injury at the level worldwide, large touch quote infection, hepatitis B virus, and the aging with greater responsibility for causing diseases, especially in countries of high risk where vaccination are infusion. Thanks.